Hi, Sydney.
Hi.
Welcome in today.
Thank you.
How are you doing today?
I'm doing well. How are you?
I'm doing really good. Thank you for asking. It's a pleasure to see you again. I'm going to go ahead and ask you to verify your first name and your date of birth, please.
Sydney, May 10th, 1998.
Okay, Sydney, if you could just go ahead and tell me a little bit about what brings you in today.
Sure, yeah. I've been experiencing a little bit of tenderness in my back, specifically my mid-back.
And how long have you noticed this tenderness?
It's just been about 3 days.
Gotcha. Was there any kind of injury that might have caused this, or did it just show up one day without much of an explanation?
Yeah.
Gotcha. Now, since I haven't seen you in a few months, I'm just going to go ahead and ask, have you had any new daily medication in the past 6 months?
No, I sometimes take allergy medicine.
Gotcha.
But no daily.
Do you have any new allergies that have developed in the last 6 months?
Just pollen.
Gotcha. Have you been out of the country in the last 6 months?
No.
Have you had any major surgeries in the last 6 months?
No.
Okay. Now this mid-back tenderness, is it on the surface of the skin, or is it more, in the musculature? Have you tried messing with it too much, or you tried not to touch it?
Yeah, I tried doing some gentle stretching, and that was okay. But it is a little tender to the touch.
Okay.
Mm-hmm.
Have you tried any over-the-counter medicine or any ice pack or heat packs?
Yeah, I've been icing it.
Gotcha.
And I took some Advil.
Okay, Sydney, well, you're definitely in good hands today. I'm going to ask you to go ahead and lay down with your stomach first onto the table here, and we're going to take a look at your back.
Perfect.
All right, Sydney, I'm just going to gently move your hair out of the way so I can undo the back of the gown. Just going to gently drape it onto your sides to expose the back. I'm going to go ahead and put on my gloves as well. Just going to begin by gently pressing into your back. We have some nice city ambience in the background here. Just gently palpating around the spine and the shoulder blades with my fingertips, making sure to press deep, but not too deep as to avoid causing you any kind of discomfort. Is this around the area that you're experiencing the pain?
Mm-hmm. That's it.
Gotcha. I'm going to begin by using a visual inspection of the skin. I do see a tiny scratch. It wouldn't be enough to cause this level of discomfort for you, but it might be something to note. Your skin looks really healthy. The skin tone is really even. There's not any lumps or masses beneath the skin, which is a good sign. I do notice a bit of inflammation in this area just by touching. I'm going to go ahead and circle back around to that in a little bit. For now, I'm just going to continue to place my hands on your back, feeling how the muscles are sitting beneath the surface of the skin, making sure that there's no obvious problems that my fingers and my palms can feel. Now I'm going to use my hammer tool to lightly inspect the area. First, I'm going to go down the vertebrae of the spine. I'm just resting the two fingers, the two pointer fingers on my left hand on the vertebrae. I'm gripping the hammer with my right hand. And gently, I'm going to bring down the nose of the hammer onto my two fingers and give two gentle pats. This helps me to feel the structure and make sure that there's no unusual responses to the pressure. The skin was reacting and the muscles were reacting in a healthy, normal way to the pressure of the hammer, which is a good sign. I'm going to switch my focus to the surface area of the skin just to rule out any surface infections. Like I said, the skin tone is really even and clear. The skin looks and feels very healthy and vibrant. I'm just going to be using one of my tools here to Gently rub in circles on the surface of the skin. And watching how the skin reacts, making sure there's no signs of redness, no flakage or any excessive dandruff. Not seeing any flaking or any dandruff or redness, which is a good sign. It indicates that this problem does lie below the surface of the skin. I'm going to go ahead and switch over to my tuning fork here. I'm going to go ahead and press the end of the tuning fork into the skin along the vertebrae of the spine. I'm going to ring the tuning fork so you should be able to feel a vibration sensation, and then I'm going to ask you when you notice that that sensation stops. Can you feel this?
No.
Okay. How about now?
Yeah.
We're going to go ahead and start then. And if you can't feel it in a certain location, just tell me I can't feel it.
Stopped. 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 Stop. Stopped. Stopped. I can't feel it.
Gotcha. Okay. I'm going to go ahead and switch over to a sharp or dull test to test the sensations of the skin. I have two different tools here with me. There's one with a sharper series of points, another one with a nice cottony dull sensation. This is going to be what the sharp sensation feels like, and this is the dull sensation. Do you notice the difference between those two?
Yes.
Now I'm going to go ahead and start. Just let me know if the sensation that you feel is sharp or if that sensation is dull.
Sharp. Sharp. Dull. Sharp. 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 Dull. sharp, dull, sharp, dull, sharp, 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 dull, sharp, sharp, dull, dull, dull.
Okay. Alright, Sydney, now we're going to move on to a different test. This one is going to be very similar in style, but instead of sharp and dull, we have warm versus cold. For warm, I'm just going to be using my 3 fingers here like this. And for cold, I have a cold roller here. This is going to be what that feels like. Do you notice a difference between those two sensations?
Yes.
Okay.
Warm. Warm. Cold. Cold. Warm. Warm. Cold. 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 Warm. 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 Cold. Cold. Warm. 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 Cold. 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 Warm. 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 Warm.
Now, both of those tests yielded pretty positive results. There was a few errors here and there, but nothing to be majorly concerned about. I am going to go ahead and measure the swelling now, just to have a reference point between the two sides, as I'm noticing that this near side does feel a little more swollen than the right side. You can go ahead and continue to relax while I take these measurements. Okay. Sydney, there definitely is some swelling and tenderness in this area, exactly like you said. To determine the cause of that pain and discomfort, we are going to want to do some more tests. That's going to be with another department. We're going to go ahead and schedule that with you in a few days. In the meantime, though, I am able to offer you a little bit of treatment options that I'm going to explore today and hopefully give you a bit of pain relief until we can see you again and get to the bottom of this. First, I'm going to go ahead and use some rosemary oil and infuse that into the skin. Just going to gently place this in drops along the back. Just going to gently rub that oil in with my gloved hand, letting the natural essence of the rosemary absorb into the skin to help soothe the inflammation. Now I'm going to go ahead and use some of the stone tools that I have here. It's going to be a bit cold to the touch, but it's going to help to ease the pain around the tenderness that we discussed. Just using the flat side of the stone to massage the skin. Working the stone down along the curvature of the spine, around the shoulder blades, helping to ease that tension, as well as the tension around the spine. And just massaging the stone and moving it in nice tender circles. we're going to be switching over to these two egg massagers. Just gently moving these eggs along the muscles. The little noises coming from the eggs, the little rumbling, can help soothe the skin and the muscles on a deeper and nourishing level. Now lastly, I do have this wooden massager tool. Just going to gently bring over the skin. Okay, Sydney, I am definitely feeling a slight easing of the stiffness that was in your back when we first started our session today. How is your back feeling after our brief bout of treatment?
Much better.
Okay, that's good to hear. I am going to go ahead and have you talk to my receptionist to schedule that upcoming appointment where we're going to definitely dig a little deeper and discover the source of that discomfort. But for now, I'm going to go ahead and prescribe you some pain relief medication until then. Okay.
Thank you.
My pleasure. Have a great rest of your day, Sydney. Thank you for coming in.
Thank you.